Hi, I am Linda, the creator of information about arthritis. If you are new to this channel, don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notification of new videos when they are released. Crohn's and colitis are two lifelong conditions of bowel inflammation. Another name is irritable bowel disorder or irritable bowel syndrome. Many people suffer in silence as the symptoms can be an embarrassment. The symptoms that you could develop are different from person to person. Crohn's and colitis are similar and usually come gradually. There could be a sudden bout of diarrhea and frequent bowel action. Rectal bleeding, abdominal cramps, also weight loss, fever, and may also feel tired. Symptoms could be mild to severe, become life-threatening, and require hospital treatment. The inflammation and sore bottom could be with you every day. This is called a flare-up. Or it can be in remission, meaning the symptoms are not present. Unfortunately, there is no cure for these long-term diseases. All you can do is manage the flare-ups and pain. It would help if you rested with a hot water bottle to ease the pain. Or if you are having a flare-up, you need to be near a toilet and rest. Crohn's normally affects the end section of the small intestines and the large bowel. The inflammation could spread into the deep layers of the intestinal tissue. But the inflammation can appear in the digestive system, and this could be from the mouth to the anus. When you have colitis, it affects the large intestine or colon, also the outer layer of the colon called the mucosa. You could have continuous inflammation without any healthy spots between. Also, small ulcers can develop on the lining in some cases, which may bleed and produce pus. The common symptoms are severe fatigue and frequent bowel movements. Another serious risk is the rupture of the colon. To date, there is no known cause of these diseases, but research points out 4 factors. Factor 1 is the body's immune system attacking healthy tissues and fighting infections. Fact 2 is genetics. This could be that the disease develops in 1 in 4 people with a family history of the symptoms. The second fact is that research has found several genes that could make it more likely to develop because many genes are linked to the immune system. Number 3 is that bacteria is present and linked to onset. This could be a stomach bug or an abnormal balance of bacteria. The last one is the environmental factors. Where or how you live could influence the condition's development. When I was diagnosed with colitis, I was young and stupid. I was desperate to lose some weight. I tried all sorts of diets, but to no avail. I ended up on a fruit diet, fruit for breakfast, dinner, and a bowl for supper. Not knowing this at the time, I was eating acids, such as oranges, berries, and bananas which have sugar and nothing else. Until one day, I was nausea, diarrhea, and feeling sick and dizzy. Finally, I was so ill my husband called the doctor in. The doctor sent me straight to the hospital, where I was found to be so dehydrated that they could not find a vein in my hand. They ended up finding a vein in my foot, so there I was with 2 drips in my foot. At first, they did not know what was wrong with me, and I had to stay in a separate room for 6 weeks until the doctors found out what was wrong. After 6 weeks, they found that I had irritable bowel syndrome, which is in the colitis family, because of my citrus fruit diet. Now I have irritable bowel syndrome, for the rest of my life, just because I wanted to slim off. The conditions are similar when you are diagnosed with Crohn's or colitis. Therefore, the diagnosis can be difficult. When you go to your doctor for the first time, they will give you a health check, such as a sample of blood. This checks for anemia. The doctor will want a stool sample to rule out any infection and check for inflammation. They will also check your stomach for any tenderness. If any tests are inconclusive, a referral to the hospital may be needed. You may have a colonoscopy or endoscopy to determine the severity and extent of the inflammation. They could take a tissue biopsy. Unfortunately, these diseases are incurable, but some treatments can alleviate and control the symptoms and reduce flare-ups. A healthcare professional will treat you with your doctor, specialist nurse, and a specialist doctor. This team will help and advise you on the best course of treatment. You could be given several medicines, such as aminosalicylates, that work on the lining of the digestive tract to reduce inflammation. When you have severe bouts of this disease, steroids are more potent and used to lessen the inflammation. But this has serious side effects. Therefore, it is used in the short term. Often immunosuppressants are used alongside steroids to reduce the immune system and reduce inflammation that may return after steroids have stopped. There is also biological medication that works on your immune system that blocks the protein used by the immune system to stimulate inflammation. It would be best if you went on a special diet that manages the disease. This is where the foods are in blocks of 3. You can eat without pain, high water foods with starchy foods, or high water foods with protein. But not starchy foods with protein will give you pain. I have done this diet for 20 years, and it does seem to work. I have fewer inflammation or flare-ups. In some severe cases where it impacts the quality of life, medication is not effective, or complications occur. Surgery may be needed. 45% of colitis patients and 75% of colitis patients eventually need surgery. For Crohn's, the surgery is to remove part of the digestive system, while for colitis they remove the colon. When you develop either Crohn's, colitis, or irritable bowel disorder or irritable bowel syndrome, it would be best to change your diet, as different foods worsen the symptoms. This means eating high water foods and starch, or high water and protein, but pain equals starchy foods and protein. The difference between Crohn's and colitis is that Crohn's disease affects the small intestines to the large bowel, and colitis affects the large intestine and the colon. Both diseases can become severer with pain and inflammation. I am not a medical professional, and the information in this article is for information only. Always consult your doctor if you have any worries. I hope this video has helped, and do not forget to subscribe to my channel and push the button to receive a notification when new videos are released. Good luck, Linda.